reports of elder abuse have decreased by 15%. Due to the shelter-in-place order, personal contact of elders with care providers and mandated reporters was restricted. The lower number of reports indicates the impact of social isolation due to COVID-19 and the reporting of elder and dependent adult abuse. So what can we do to address social isolation during the shelter in place?
What we've been doing collectively at Adult Protective Services is checking in on our clients, especially the ones that are vulnerable, checking in through the phone. Some of our clients are tech savvy and have emailing them, seeing how they're doing, talking to their family members, encouraging them to talk to them. Also just being creative and figuring out a way, how can we socialize with our seniors?
I think what we've been doing a lot of, and I've been doing this as well, checking in with our clients, seeing how they're doing, but asking questions. Usually we don't, ask, do you have food? Do you have your medications? Because we're kind of assuming sometimes that, they have access to these, but especially at the beginning of the pandemic when we didn't know whether or not these people should be even going out in public. It was scary for people. Just trying to do those things for clients when possible, if there was nobody else to do that for them.
We're doing the doorstep visit. So we drop supplies to the door, whether it's food, whether it's activity supplies, whether it's medication, and drop it on the door and have them open the door, and we stand back and we have conversations. So we're doing this visual thing. We're also doing a lot of fun stuff, which I want to show you a video about.
Being the legal durable power of attorney for finance gives us the opportunity to manage the finances on behalf of the seniors when they get to a point where they no longer can, whether they lose physical capacity or mental capacity. So that is a very critical role, especially for seniors.
Really, in the Area Agency on Aging, what we're trying to do is strengthen our community providers. How can we make sure that you will have the resources to keep people protected?
So we had to shift and have our drivers that would be out delivering 5 days a week call people on the 4 days that they weren't delivering. I think, again, not having eyes on folks really makes it difficult to identify some of those potential cases of abuse. But it really did help seniors feel more connected and like there was somebody out there caring for them.